Hi, I'm Mike Pownall, and welcome. And I'm with Dr. Mark Revenaugh of Northwest Equine Performance. And Mark and I are really excited to talk about the Equine Regenerative Medicine Orthobiologics Summit happening October 5th to November 3rd. Welcome, Mark.
Thanks, Mike.
So this summit is really, I mean, it's you're the brain behind it. This is like almost, I would say, a passion project of yours. Talk to us about what is this summit. Tell us, what people are going to see over this 1 month.
Sure, Mike. I mean, I think this is a really important thing on everyone's minds these days. There's a lot of new regenerative medicine options out there. We're all trying to figure out what are the best ones to use. Should we use them? Which ones should we use? When should we use them? How do we validate them? Those are all really big, broad, sweeping questions that are facing our industry right now. And the idea of the seminar is that we can get together some of the people who are really going to be able to make a strong representation from a clinical perspective as well as from an academic perspective.
Yeah, the lineup is incredible. You, of your connections, we've been able to get great equine researchers, practicing equine veterinarians. But what really is unique about this summit too is we really have brought in a whole host of human researchers and clinicians too to get their perspective on how human medicine is using a lot of these therapies.
Yeah, that's true. This meeting is a natural consequence of the work we've been doing over the last 8 years with our high performance sports medicine group. And that's really been a collaborative effort between different arms of the industry, including the human sports medicine field. And it's been fascinating, all there is to learn, but even more fascinating how much interest there is from their perspective to hear and learn about what we are doing.
Sure. One of the interesting things about this is the structure of this, and that it's every Monday and Tuesday from October 5th to November 3rd. Monday is the evening for North America, and Tuesday is the evening for Europe, the EU, which will be early afternoon, late morning for those of us in North America. And we've asked people to submit presentations. They have to answer 10 questions, which I think is really interesting. And you can see them on the website for the summit, but it adds a bit of rigor or discipline where people have to answer these questions that busy practitioners and even other researchers can look at it and get a good sense of, is this modality appropriate for me? Is there more about it? We hear so many things about so many things, and as busy equine vets, we're just trying to find the best things for our horses and our patients. And so talk to me a bit about, or tell us a little bit about how you came up with this format, because it is quite unique.
Yeah, it was just, again, a very natural consequence of a lot of conversations with people. I think we need to reestablish, hit the reset button on how we're making some of the decisions and assessing our products. So the idea would be to get kind of a side-by-side analysis of these different products, get an idea what is known about them. Do you even know what's in the product? How do you know what's in the product? Do you track safety? Do you track efficacy? And then, efficacy is always tough. But then hearing a clinician's perspective on it, you know how this goes. I mean, there's tens of thousands of horses that have been treated with certain products. And if you're on the East Coast, they like this. And if you're on the West Coast, they like that. And if you're at one institution, it's this. And, it's just time that we kind of pull it all together and start figuring out what is the real rationale? What is the validation? What is the clinical experience with these different products at this point in time? And that's probably the biggest thing I would emphasize. As a clinician, you see a horse, you got to decide up front what you're going to do with that horse. It won't help your client to say, hey, in a year, I'll probably know what to do. It's the here and now. And the philosophy here is, how do we make our best informed decision as of now and this is not a definitive end knowledge point. This is a point in time. And so next year, if we have it again, there will probably be things that contradict what we say this time.
So
But we're trying to,
it's not like you're out to
we're
prove one's right or what's wrong. It's more of a discussion and a broad analysis of the product.
absolutely, we're not there to endorse or to villainize any products at all. We're just there to try and figure out what they are and what we know about them.
Right.
And yeah, that's it.
So, as I said, you've had your performance group in the past. COVID has changed this from an in-person event in April to this now virtual event that's actually going to be a global event. Why did you want to do this? I mean, you're a busy practitioner. I mean, just trying to get you and I to coordinate our schedules just to record this.
Yeah.
You're a busy person. You have a strong family life. Why this? You've got, I'm sure, other things you could be doing.
Yeah, it's just the conversation just keeps coming around. It doesn't go away. And it's just time. I don't know. We've done a lot of work behind the scenes with this high performance sports group. This is just one aspect of what the group is interested in, but it's a really important one. And I think it's time that the industry is ripe to kind of start rethinking how we're evaluating, how we're, making determinations about safety and efficacy on these products, so that as we move forward, we can get better. Because right now, there's one study type evaluating one product, and a completely different study type evaluating a different product, and no study type evaluating the last product.
Yep.
All the people want to have a conversation, but you can't really evaluate these things comparatively very well. Yep. So, long answer.
So what's interesting too, and I think this, would be an interesting place of discussion, is talk about the format every night, because I think that is really unique, is that we're having a theme every night, 2 presentations, but talk to me about how things have been selected, speakers have been selected, and the whole structure.
Sure. So the structure is, hopefully fun. It's unique. The idea is that we have a featured lecture which will address a specific product or technique, 30 minutes, followed by a panel discussion where 3 panelists from different backgrounds will then be able to question the presenter about what they presented. The presenter will also be asked to write an abstract and provide references for statements that they make, if they're making statements about published material. And yeah, that's the first part of it. Each session is a little unique, and I've empowered each moderator to kind of custom fit their topic to their own format. There are a couple of sessions where it's more heavily aimed towards MDs, and I mean MD speakers, and I think they will be absolutely fascinating to the veterinarians to hear what is being done in the human field. But again, the idea, each session is kind of designed for a conversation at the end of it, which would be, okay, now we've got all this new information. What do we do with it? How do we think our way through it? And hopefully having some bright academic minds, some experienced clinician minds, and an MD in on that conversation will give the attendee some real ammunition as far as being informed and making their own decision. Not a decision that we're telling them about, but making their own assessment of what they've heard, and kind of getting the practitioners really, and everyone really thinking for themselves about what they think is right or wrong, or what they want to be using.
Right. And one of the interesting things about this summit is that we're using a really neat software called Whova, where it's an app. So as the attendee, you can download it. But what's really great about this app is that you can post questions in advance. You can find colleagues to have discussions with. There'll be breakout areas for the sponsors. There are some of we have some really great sponsors who are in this field. And so it really helps us to develop a great community. And also these presentations and the chats will be available for a year after it. So it's sort of these things where you can come and go and you want to review this, or you have the opportunity to try one of these orthobiologics maybe 6 months from now, and you go, yeah, no, they talked about that in the summit. You can go back, listen to it again, watch it, read the abstract. So it really is developing a great, let's say, a bedrock for future learning and continuing education for busy practitioners.
Yeah, again, I mean, I think the overarching idea here is that we're providing a platform for a different type of conversation to move forward.
Right.
And, you know, parts of it will work. I'm sure parts of it won't work.
Well,
But we're going to, you know, we're kind of rolling the dice and seeing what happens. And, you know, this discussion about ongoing conversations, what have you, that's really a credit to you guys at Oculus. You've done an amazing job. I can't even organize a dinner party, and here you guys are putting all this together. You know, it's amazing. We really, you know, that it's you've played a huge role in how this all has come together. And honestly, it's come together much bigger and much better than I ever dreamed. Partially because of this COVID restriction that has forced us into making an online platform and really opened the floodgates to so many different perspective and experience bases from around the world.
mhm. Well, I think it really is a testament to your vision to start this, and, you know, collecting really interesting people and people of different skill sets to help this all come together. So once again, it's October 5th and November 3rd. You can go to the website, equineregenerativesummit.com. All the information there for registration is there. You can book yourself for the whole session, or there just may be one evening or 2 evenings you want to participate in. So there's quite a lot of options. Mark, really appreciate you taking the time out of your busy day, and I'm looking forward to the success of this summit.
Sounds good. Thanks.